Rwanda's government opens the Kanyinya Coronavirus Reception Center to journalists for the first time. It's a rare move on the outskirts of the capital, Kigali, to publicize and reassure 12 million Rwandan citizens that all is under control and to show the world how the country is dealing with the pandemic.
We are at the stage of trying to size the outbreak in the country because we have our first cases already in country since 14th of March. 88% are imported cases, means we have few cases that are confirmed by contact with those imported cases.
Several patients are being monitored at this center for around 80 people and at a second specialist hospital too. Health workers say none of the sick require intensive care, but there are enough ventilators for those who may fall seriously ill. Rwanda has about 46 ventilators set aside for COVID-19 patients. Many African countries are struggling to keep up with testing. Health officials here say they can test up to 700 people a day.
If we detect suspected cases, we'll test them and we'll test them every 3 days. If they get sick, we'll bring them to this center.
The government ordered a total shutdown in late March when the infection rate increased. All borders and airspace have been closed to stop the disease being imported. And it's all hands on deck at this biomedical center as volunteers and government workers keep track of those quarantined in government facilities and at home.
We follow them up on a daily basis to see if they have any symptoms, if they have developed any. We refer them and connect them to our rapid response team for evacuation and taking them to different facilities for closer follow-up.
Many Rwandans say the emergency response by their government has been swift and robust. Health workers say they're confident that they have the capacity to contain the disease, but they're also concerned that if neighboring countries fail to stem the spread, then COVID-19 will be hard to deal with because of the high number of illegal border crossings. Catherine Soy, Al Jazeera.